Hello, my name is Isabella Chiriboga. I am a student, a dentistry student from Anahuac, Cancun. This is a presentation made for my geonomics and protomics class. Okay, let's get started. First of all, I want to thank you for inviting me to the first Congress about International Oral Health Microenvironment Conference. My topic today will be survival of dental restorations in patients with dry mouth. So let's get comfortable and let's get started. Today's topic. First, I'm going to be talking about the saliva, whether its functions and the benefits, the background of why people have a dry mouth, the effects and harm in the mouth because of a dry mouth, the natural history about cerestomy, the hypotheses of my theme that are because of the lack of saliva, the restorations are mostly a failure in the dry mouth patients, and the study that proves my hypothesis. The saliva. Well, it has many functions, but I want to start saying that the saliva, it's 90% water and 1% electrolytes. So it have various electrolytes like sodium, potassium, chloride, phosphate. It have a lot of minerals. It have enzymes that help decompose the carbohydrate molecules. It regulates the pH of the mouth. It have a buffer effect. It have antibodies, and it have nutrients, and it helps lubricate the mouth. One of the main functions of the saliva is the microbes, because it helps in the mouth. It's a balance between microbes, because the saliva have a lot of communication with the outside, so there is a lot of bacteria, and the saliva helps the produce of antiviral, antifungal, and antibacterial microbes. What's the background of a dry mouth? Well, we have three main reasons why a person have a dry mouth. It can be given because of hyposalivation, that is a condition of having reduced saliva production by the salivary glands. It's a medical sign, and you can measure it and watch it. What's the difference between hyposalivation and cerestomy? Cerestomy is the sensation of having a dry mouth. This can be given by different factors, such as a mouth breather, people that breathe through the mouth, chemo patients, medicine, and lack of liquids consumed. And the Sjögren's syndrome, it's an autoimmune disease that affects the tear glands and the salivary glands, reducing the production of the saliva. It means that our own body destroys, for a reason, the glands that produce the saliva. And this can be a cause of having hyposalivation. Like, you can't develop hyposalivation because of Sjögren's syndrome. Did you know that 22% of the population have a dry mouth? Well, this can be really bad for those people, because you can have a lot of effects and harms because of it. But there are some treatments for these diseases. The natural history about cerestomy. Well, it can be caused by medicines like antihistamines or hypertensive medicine, analgesics, diuretics, antidepressants. It can be a glands problem, because such as the Sjögren's syndrome that we just saw. It can be because the person is a mouth breathing person, so he or she breathes through his mouth, and there can make it dry. And the chemotherapy or the radiotherapy in special type of diseases. The diseases associated with serostomy, it's Sturgeon syndrome, it's HIV infection, it can be diabetes mellitus, it can be cystic fibrosis, sarcoidosis, or hypertensive. Then we have psychological changes like the difficulty of speaking, because if your mouth isn't lubricated, then it's more hard to you to pronounce words, because the movements of the mouth it gets more difficult, so you can't have a correct pronunciation of the words. So because of that, it's a result of the difficulty of speaking. You have also swallowing problems, because the alimentary bolus isn't formed well, and plus the walls of the mouth and the esophagus aren't well lubricated, and that's why you have swallowing problems. And it also have a taste alteration. The defect or damage of having serostomy is the predisposition to develop caries, gingivitis, burning mouth syndrome, plaque tongue, erythematosus mucosa, thrust or cracks in your teeth. The treatment is bubble gum without sugar, because if you keep chewing inside your mouth, your brain will send your body to produce more saliva, and you keep stimulating your glands and you keep producing saliva, so your mouth gets lubricated. Good hydration, which means a lot of consuming of water, electrolytes, and there's also a good alternative. It's artificial saliva. You can find it in the pharmacies. The effects and harms in the mouth. Well, as you can see, you are at risk of caries factor, because without the saliva, there's a disbalance between the microbes, and they can provoke more caries inside your mouth. Also, gingivitis, erythematous mucose, candidiasis, or shaved tongue. The hypothesis of this presentation is that restorations in patients with dry mouth have a short survival time, because the saliva, one of its main function is to have a balance between the microbes of the mouth. So if there's that disbalance, then you have a risk factor of caries or restorations not to go well, or have a short survival time period. And everything here, it's a factor. Materials of the restoration, the size of the cavity, the sex of the person, the age, the oral hygiene of the person, and the tooth type. It's different to have a molar or a canine, or so a premolar. So they have a difference between the tooth type also. Here I want to show you a study. This is a study that was released of the data collected from the electronic patients files of the city of Oulu Public Dental Services in Finland. The study was made to 71 dry mouth patients and 142 controlled patients with dry mouth. They have a treatment going on, so they have more saliva. It takes about the survival of 3,208 restorations, and it was analyzed using the Kaplan-Meier survival curves and the multivariate Cox regression analysis. Here you can see that the dry mouth patients represent their 303%. It means 71 dry mouth patients, and we are talking about 2,042 restorations made in the 71 dry mouth patients, and we also have 142 controlled patients that represents the 66.7% of the patients in the whole study, and it talks about 1,166 restorations. So it talks about the patients with dry mouth. The main factor because they needed a restoration was because of caries. And it talks about a 40% of the whole patient. This was the reason because why they needed operative treatment. The chipping factor was 20.5%, and various other indicators were the 13.2%, whereas the remaining 26.3% of indications has not been registered. The result. From extracted teeth that were restored during the observation, 6 of them were fixed with prosthetic crowns, it meaning the 4.5% of the whole teeth, and the 127 were being restored using only direct fillings materials like composite, glass ionomer, or their combination. The survival of restorations in surgeon syndromes or radiotherapy was shortened compared to the patients with hyposalivation or cerestomy of unspecified etiology, meaning that if these patients that have dry mouth, they had surgeon syndrome that provoke hyposalivation and cerestomy, their survival restoration was shorter than the people that have dry mouth because of other factors that develop hyposalivation or cerestomy because of other factors provoke this disease. The conclusion is that the restoration and tooth survival were severely shortened in dry mouth patients, especially their glass ionomer cement fillings and large composite fillings, whereas the fixed prosthetic crowns had acceptable survivals. Meaning that, well, it was better to have the crowns rather than the fillings because they have shown that they are had a more acceptable survival, and that when informing a dry mouth patient unexpected survival of a restoration, one should take into account that the shortened survival time. Meaning that if you one day have a patient that have a dry mouth syndrome like disease, you know that he have a dry mouth and you're going to make him a restoration, you should talk to him and explain that the survival time of this restoration is shorter than what it usually is being expected because saliva have a big important impact in our mouths. Thank you so much for hearing me, your attention, and this is the resources where I found the whole information.